In 2013, the Alberta Dental Association and College issued a disciplinary warning about Dr. T.H. of Edmonton, Alberta. The dentist was found guilty of professional misconduct in the placement of 9 porcelain veneers. The veneers appeared to be placed as a technique to make the teeth look straighter. The dentist had warned the patient that it was not the ideal choice and recommended orthodontics, but the patient refused multiple referrals to a specialist and chose the porcelain veneer route, which is often referred to as instant orthodontics. The details suggest that the 9 teeth were generally healthy and did not require any restorative procedures for oral health reasons. The placement of the 9 veneers required very substantial and aggressive reductions in tooth structure that removed large amounts of enamel and significant amounts of dentin from the 9 healthy teeth in order to place the veneers, which would close the diastemas between the patient's upper and lower central incisors. Okay, so I guess it had to do with some spaces between the teeth. Let's see, found within 1 year of placement of the veneers, the general dentist and endodontist recognized that a substantial number of root canals were required on the teeth that had veneers placed. The endodontist identified at least 5 teeth where endodontic treatment were required to save the teeth. There were concerns about 2 additional teeth where the endodontist suspected that endodontic treatment would be needed in the future. Let's see, the hearing tribunal found that in less than 2 years after the completion of Dr. H's treatment, the patient suffered further deterioration of the health of these teeth and would require extensive work on almost all the teeth. Let's see, Dr. H recognized there was a large risk of root canals. I'm not surprised by the root canals. So the patient had actually been warned of this risk and accepted the risks according to the dentist. And I believe there were consent forms. It suggested that there was no documentation to support Dr. H made it clear to the patient that her brochure on veneers did not describe the procedures she intended to carry out. So apparently you have to also double check your brochures and discuss modifications. The hearing tribunal found that the patient's 9 teeth were over-prepared and over-reduced by Dr. H, and far too much tooth structure and dentin were removed. The dental abscesses that resulted in the pulpal necrosis, or it should be the other way around, the pulpal necrosis resulted in dental abscesses, and there was a need for multiple root canals, as discussed. It says, hearing tribunal found that margins of the teeth were poorly prepared by Dr. H, and this resulted in open and poorly fitted margins after the veneers were placed. Well, it could also have been a poor impression, perhaps a lab error, and perhaps they could have been replaced if desired. Hearing tribunal acknowledged that and agreed Dr. H's preferred procedure would have been to close the patient's diastemas by orthodontic treatment before placing veneers. The hearing tribunal found that the amount of tooth enamel and dentin removed from the healthy teeth, and this should not have been attempted without the orthodontic treatment. So anyway, they acknowledged that the dentist actually did recommend a less aggressive treatment, but the patient accepted the veneer choice, which again is not considered illegal anywhere. It's just a less desirable approach according to many experts. The hearing tribunal found the patient was not fully informed about the differences between proceeding with orthodontic treatment and proceeding without orthodontic treatment. The hearing tribunal found that a discussion about referral to an orthodontist was made in 2004 was not sufficient to constitute informed consent about a procedure proposed in 2008. and they wish to stress it was not acceptable to seriously damage healthy teeth for cosmetic purposes. Also, dentists must clearly explain, document all the potential risks of the cosmetic procedure and all of the likely and potential impacts of the teeth involved. The hearing tribunal did not agree that the fact that a procedure is considered cosmetic means that aesthetic considerations can justify the over-reduction of enamel and dentin that severely impact the long-term health of the teeth. Well, if they applied this rule to cosmetic dentistry, there'd probably be a lot of dentists that don't have licenses. In the final analysis, they suggested that in every case, including cosmetic cases, a dentist must be careful to take into regard the overall health of the patient and avoid treatments that impair dental health. The hearing tribunal stressed that even with cosmetic treatment, the overall health of the patient's teeth and impact of the proposed procedure on the health of the existing teeth are important and must be considered. While it's doubtful that the patient's overall health were affected by the dental complications, but definitely it affected the health of individual teeth. The appeal panel ordered that Dr. H be reprimanded and Dr. H repay the patient the sum of $13,500 for the fees paid to the placement of the 9 veneers. And Dr. H must pay the costs of the investigation and hearing of $130,723. So the patient did get a refund of over $13,000, but it cost over $130,000 to figure that out. So probably the dentist is reconsidering the idea of just paying for a few root canals from the beginning. And according to a reliable source, this dentist has spent close to $1 million on legal fees on top of these costs. Now, in the final analysis, the discipline did not mention LVI training. And why this is important is LVI dentists have been identified as being kind of a trending in the malpractice areas because of the information that are taught at the LVI seminars. So a lot of experts have mentioned a concern about this, and some authorities are actually beginning to not allow dentists to post their LVI training, and they also do not allow certain approaches taught by LVI. Let's see, but again, Alberta is a little bit unusual because it has helped actually promote LVI courses, and it has given an award to the dental lab that promotes LVI in Alberta. So another issue is that the same authority that punished this dentist for performing instant orthodontics also attacked a dentist for writing a book about the problems with instant orthodontics. So, but to back up a little bit, before this issue had come up with this particular dentist, the Alberta Dental Association, probably around 2003, had published this article by Dr. Gordon Christensen saying that overtreatment in aesthetic dentistry is nothing less than overt dishonesty in its worst form. And in another case, Dr. Michael Zook was attacked for writing a book about instant orthodontics, and in the book it states having braces is often a better choice than porcelain veneers on page 63, or this could be from a website. But anyway, the issue is that they, in one case, were saying braces are a better choice, and then they tell another dentist you can't tell a patient that braces are often a better choice than porcelain veneers. So the the dental authority basically will bash you no matter what you do, and go to the next case.